Since the discovery of the insulin treatment for diabetes, the public had been led to believe that here at least the medical profession have vindicated their right to be considered as the nation's saviors from disease. But, as a matter of fact, nothing proves more conclusively than the insulin treatment for diabetes. The contention made that drug usage does nothing to remove causes and really cure disease, but merely tampers with and removes or suppresses symptoms. The insulin treatment for diabetes takes no notice of causes, but merely tries to get rid of the effects of diabetes. It can never be claimed to be curative by the widest stretch of the imagination, for in the great majority of cases, it has to be taken regularly forever after, once it has been begun. When the insulin craze first started, the public were led to believe that insulin was a positive cure for diabetes, and the press went wild with excitement over this wonderful discovery of modern medical science. But sad disillusionment was in store for those diabetics who believed what they were told. Many a poor wretch has been turned into a human pincushion as a result of having daily insulin injections for the rest of their life as a cure for their diabetes. It is generally supposed that in diabetes, the pancreas is at fault because the pancreas secretes a fluid which plays an important part in the digestion of starches and sugars. But the disease is really one of faulty nutritional balance, following a breakdown of the whole nutritional system of the body, in which the liver and other vital organs are involved just as much as the pancreas. The trouble is far more systemic in origin than the failure of any particular organ, and takes many years to develop. Long-continued unwise feeding habits, in particular the use of white bread, white sugar, meat, boiled potatoes, cooked vegetable, pastry, pudding and pie dietary of today, exhaustion of the system through excesses and indulgences of all kinds, protracted worry, overwork, etc., and suppressive medical treatment of former disease are the chief predisposing factors concerned in the setting up of this systemic disturbance of nutritional activity, which we call diabetes. The cause of practically every form of disease is poor diet, aided by general wrong living and often environmental factors. But why these should lead to high blood pressure and kidney trouble in one person, asthma and bronchitis in another, and diabetes in a third, we are not able to say. All we know is that this is actually the case, and it can only be supposed that the constitutional makeup of the individual and possibly hereditary tendencies play the final part in determining just what form disease will take in any particular case. Still, the great point is that if people do eat and live contrary to the laws of nature, disease in one form or another is bound to be their lot, and the more such disease is suppressively treated by drugs, operations, etc., the more will chronic conditions of the type of diabetes, kidney disease, asthma, bronchitis, etc., be their ultimate lot. It is a most significant fact, but the more readily medical science devises means of suppressing colds, chills, fevers, influenza, etc., the more do chronic diseases of the kind here referred to grow, as witnessed by present-day disease statistics. The sufferer from diabetes who places himself under natural cure treatment is in an entirely different position from the insulin-riddled patient of orthodox medicine. When treated by fasting and strict dieting, diabetes is a comparatively easy condition to get rid of. It is really cured that way, not just temporarily alleviated as when insulin is used. That is because under natural treatment, the actual causes of the disease are removed and the whole health level of the patient built up. But no word appears in the news about the wonders of the fasting treatment for diabetes, or the fasting treatment for any disease for that matter. But it is results that count, and that is where natural cure scores all the time, not only with regard to diabetes, but with all diseases in general.